What do you see here? Exactly, a transverse distal phalanx fracture. I knew you'd get it. Here's your fracture. It is transverse and it's of the distal phalanx. This one's a little tricky. What's all this shading around? That is soft tissue. And we put that in here because soft tissue can be detected on radiograph. But what we wanted to look at more specifically here is this distal phalanx. It doesn't look exactly right. It's not very clear with this anterior to posterior view. So a lateral view is done in order to see exactly what's going on with the distal phalanx. That doesn't look exactly right. On the lateral view, you do see a significant problem. What you see is a bony mallet deformity, an intra-articular problem. So what you were seeing was that view of the fragment on that anterior-posterior view, but you couldn't tell that there was a significant fracture deformity until you look at the lateral view. That's why the physicians will order multiple views to assess fractures in the best fashion. So what's going to be done for that? Exactly. Very easily fixed with closed reduction, restored articular surface with a K-wire pin. This is what we don't want. Oops. Pinning where they missed the entire finger. What have we got here? Does it look like missing bones? Kind of interesting. Exactly. It's immature carpal bones in a child. In this case, we see a preoperative patient with rheumatoid arthritis with joint dislocations and subluxation. Here the patient is post-op after their reconstruction. What you see here are the grommets. The implant also does show radiographically, but in this case you can clearly see the grommets because they're metal. And on the thumb with the subluxation, it was pinned and fused with the thumb at neutral. This X-ray shows you the hook of the hamate fracture. This is a carpal tunnel view, which we showed you back at the beginning. And here you can see the fracture segment. Here's a supinated oblique view, which you did not see earlier, showing you the fractured fragment. And this is an MRI showing you the fractured fragment. So different views will show you different areas of fractures, as we mentioned earlier. An intraosseous ganglion cyst in the lunate is noted on this X-ray. It is very rare to see this situation, and when it is seen, what is performed is again a radial bone graft. And here you can see where they took the bone from the distal radius and applied it into the area where the cyst occurred in the lunate. The patients report a dull ache very often, can be misdiagnosed as Kienbach's disease, which we will see in just a few minutes. What do you see on this X-ray? Did you catch it? The scaphoid fracture? Tricky. Got you tricked by all the fact that it was a young person, it's a teenager. Might have missed that little itty bitty scaphoid fracture, simply treated with the cast immobilization technique.